Today we're doing a mitral valve-in-valve operation. This is a first for us and for patients on the Sunshine Coast. What we're planning to do is to replace an elderly patient's valve without the need for open heart surgery.
Our patient is 84-year-old Les Gunning, living in a rural and regional area of the Sunshine Coast in Gympie.
He's had a previous open heart procedure in 2014. He's had both of the valves in the left side of his heart replaced, as well as a bypass procedure, and he's done particularly well. However, one of these valves has deteriorated now, and what seems to happen is they start to deteriorate slowly and then there's a sudden acceleration.
A valve is leaking and this replacement valve will do the job of the other one.
Dr. Peter Larsen is an innovative and well-known Sunshine Coast-based interventional cardiologist who also had the vision to improve the access to and the quality of cardiac care for all patients on the Sunshine Coast, bringing world-class care to local patients.
Hello, Leslie. How are you?
The Structural Heart Valve Clinic at the Sunshine Coast Private Hospital is an Australian first with the vital assistance of Silvia Gres, cardiology nurse practitioner, working alongside Dr. Peter Larsen.
We've been here from the beginning with you.
Yep.
I'm very proud that we can introduce here on Sunshine Coast new procedures or procedures that have been known in the whole world for, let's say, a few years. And this gentleman, Leslie, is qualified, and he's very happy that he actually is going to have the procedure. So I'm excited.
This is keyhole surgery. It's revolutionised how we care for patients with valvular heart disease. Many of our elderly patients are not suitable for open cardiac surgery, and today we plan to do a keyhole procedure where we go through the vein in the leg up to the heart and replace the valve all through a small tube without even making one incision.
I believe they've been doing this overseas for some time. Certainly in Queensland they've only done a few of these cases, and they've been doing them for a number of years. Patient selection and suitability is key, and then having the people involved in the delivery of service, training them up to have the appropriate skills to do the procedure is the next rate limiting step.
So we work as a heart team, and so there's 3 cardiologists involved. I'm one of those cardiologists, one of the interventional structural heart specialists with Dr. Larsen. Our role is to place the valve and deploy the valve inside the failed mitral valve prosthesis.
Historically, patients who need valve surgery need to have open heart surgery. They have a stenotomy, the chest is opened and the surgeon replaces the valve. It's a big operation and carries substantial risk. Now, with the new technologies available, we can replace someone's valve through the artery or vein in the leg without the need for open surgery. This means that patients can walk into the hospital, have a valve replacement and go home the next day.
Hello.
Hello Les, how are you? That's good.
Yep.
Rae Duffy's my name. I'm one of the anaesthetic doctors in the hospital.
Very good.
Yeah, we met briefly last night and had a bit of a chat about everything.
Yep.
So just making sure that you're happy with everything from an anaesthetic point of view.
Yes.
So,
yes.
you know, specifically that you know what I'll be doing tomorrow.
Yep.
So first and foremost, we're just going to take really good care of you, Les.
Thank you.
All right.
Thank you.
And we're just going to keep you nice and safe.
Oh, I trust that it all goes well and that I am all chirpy when it's all over.
We have a great heart team. We work with a collaborative with a group of doctors, nurses and allied health professionals. Together we can get the patient through their operation. I can't do it alone, but I can do these operations with my team.
So Dr. Larsen and the whole team here, actually Cath Lab and onwards, that's fantastic to work like this. Everybody knows what their role is, and that helps a lot as well. And patients are more relaxed and they appreciate it. They see it.
But before we go into theatre, we have to do a scrub, which is a theatre scrub, so it's a thorough wash of the hands, forearm. Well, we're getting ready to do this case. We've got our cath lab nurse setting up the procedure equipment, patients on the table anaesthetised, the doctors are getting ready, so it's all systems go.
This new surgery has revolutionised heart care for patients around the world, and we're so proud to bring it to our patients on the Sunshine Coast. Technology is getting better every year, and it means that more patients, as they're getting older, can come into hospital, have a valve replacement or a stent and go home the next day or even the same day. It's just phenomenal.
The catheter lab and the operations team was led by Dr. Peter Larsen, and with the assistance of Dr. Stuart Butterly, he is the Assistant Interventional Cardiologist. Dr. Mark Johnson, Specialist in Advanced Cardiac Imaging. Dr. Rae Duffy, Specialist in Cardiac Anaesthetist, with the vital assistance of Silvia Gres, Cardiology Nurse Practitioner, working alongside Dr. Peter Larsen.
We've got a great team here at the Sunshine Coast University Private Hospital and pushing ahead with our structural heart program. We're very happy and proud to be part of this team and this unit that is doing this first of kind procedure at this hospital today. It's the first of its kind in our hospital. It has been done previously, but we've been solely involved in doing replacements in the aortic valve, but this is a mitral valve prosthesis, so it's a valve within the heart, and it's our first time doing it.
I've been a cardiologist now, or working in cardiology for more than 20 years, and this new surgery has revolutionised how we care for patients with valvular heart disease in Australia. It's been so exciting over the past 10 years in particular, watching these new valve technologies become more available, and we are so proud as a Heart HQ team to bring this technology to our patients on the Sunshine Coast. It's so exciting, and we're looking forward to having a successful operation, and hopefully our patient can get home tomorrow as planned.
So we crimp the valve in a two-step process. After the first step, we check to make sure that the direction of the valve is crimped on correctly, and then we'll complete the crimping process after that.
Our focus is providing the best quality care and achieving the best clinical outcomes for our patients.
The dilator's coming out, we'll get the valve in.
From transcatheter aortic valve implantation, mitral valve repair, and a broad range of structural heart interventions for patients at risk of a stroke who have arterial fibrillation.
Pacing on. Oh, the team did fantastic. The valve's in place, everything went perfectly. Great result. We're really happy. We had to make sure that the new valve was exactly inside of the old valve. It was hard to see on the X-ray, so we did the best we could, and by using the TOE with Dr. Johnson, we were able to line it up, and we just had to trust our instincts it was in the right spot.
The operation took just under 2 hours and was extremely successful.
Fantastic. Successful operation, just as planned. It's a great operation. This is the first time that we've placed transcatheter mitral valve inside an existing mitral valve. So valve in valve, first one we've done on the Sunshine Coast. For the patient, it means that they no longer will be breathless, they won't have heart failure, and they'll be able to get back to doing what they love. Everything went well, and we need the whole team to do their part, to deliver that valve from outside, up through the vein, into the heart, and into position. You saw how precise we had to be, and when we know that it's in the right position, bang, we just have to go and put the valve in and trust ourselves. Yeah, I called Les's son-in-law, let him know that everything went to plan, that we're very fortunate to have the team to deliver that valve, put it in the right position, and get a great result. It's a huge relief for us, and we're excited. We're stoked to be able to have done this.
Leslie, how are you, sir? Looking great. How do you feel now today after leaving the hospital?
Oh, it'd be good. Be wonderful.
Privileged to treat Les. He put his trust in our heart team, and we're able to get the operation done successfully. Fantastic result, and looking forward to helping more patients like Les.
Very good. Thank you. Yeah, well, if people are recommending need a heart surgery, they should definitely go forward and have it.
Oh no, thank you for this journey. I'm really excited to go from the beginning with Leslie through all of this, and until now, I'm going to discharge him. Happy moment.
Yeah, fantastic.
Up and out and ready for rehab. You wouldn't know Les Gunner had heart surgery just a day earlier. The Gympie man is now part of medical history on the Sunshine Coast.
Hello. Hello, Les. How are you?
He's the first patient to undergo a valve-in-valve replacement.
This new surgery has revolutionised heart care for patients around the world, and we're so proud to bring it to our patients on the Sunshine Coast.
Les had open heart surgery decades ago, but over time the valve has deteriorated. The 84-year-old's symptoms have been getting worse and he has been suffering shortness of breath. In the past, the fix would have meant open heart surgery, but Les was able to receive a revolutionary keyhole procedure instead.
We go through the vein in the leg up to the heart and replace the valve all through a small tube without even making one incision.
The procedure was performed at the Sunshine Coast University Private Hospital last week. It took less than 2 hours and was hailed a success.
The valve's in place, everything went perfectly, great result.
Leaving with a smile and a stronger ticker. Mel Whiteman, 7 News.
Our team is on call 24/7, 365 days per year, and provides an acute heart attack service for all patients on the Sunshine Coast.